Hey everybody, today it is interview day, and I know this is your favoriteest because I love to highlight all the different ways that we can practice as a nurse practitioner, and this is one that I know a lot of you are interested in because I hear it when you call me for mock interviews. So I'm super excited for you to meet my friend Victoria, who is a fairly new grad working in cardiothoracic surgery. So welcome to her, and if we haven't met yet, my name is Bree. I'm an RN, NP, mentor, interview strategist, and content creator. Welcome to the channel. Okay, so thank you so much for coming today. I cannot tell you how excited I am.
Of course.
Because I feel like, let me give you a little caveat here at the beginning, y'all. You know, I have to give my little speeches before I get started. But I cannot tell you how many people call me for mock interviews as new grad NPs who are working in the CVICU and who want to get in with the cardiothoracic surgery group. So anyways, Victoria has been a CVICU nurse for a while, and she just rolled right into this job. And she has some very unique things that I think she can share with you to help you on your journey. So having said that, tell me a little bit about your background as a nurse.
So I graduated in 2013 at Medical College of Georgia, now known as Augusta University, and went out to work on the post-op cardiac floor. So step down unit. I was there for a year, and then I transitioned to CVICU. So I was there for 7 to 8 years before I went back to school.
Oh, I didn't realize you had worked that long. Yeah. I was thinking you were, okay.
Yeah, 7 to 8 years.
That's a lot of time.
I know, it went by really fast.
Yeah.
So then I thought about going back to school to get my master's for like 3-4 years. I went back and forth.
Mm-hmm.
Finally went back in 2018.
What made you decide to, I mean, I know you said you debated about it for a while. I was kind of the opposite. I thought about it, and then like 6 months later I was in school. I was like, oh God, what did I do? But like, what was it that made you think you wanted to go back, and what was it that held you back from doing that?
I was never burnt out at bedside at all. I just, I guess, wanted to further my career, get more responsibility, more expertise, and still help people. So
yeah,
it
was just the natural next progression.
Yeah.
I love to hear that because I hear from a lot of people exactly what you said, is that I'm tired of the bedside. I want something else.
And I really wasn't.
Yeah.
I could have stayed.
Yeah.
So.
I think that's kind of good. I mean, part of my motivation was burnout, but I think if your primary motivation is nothing but burnout, you're just going to trade one set of problems for another. Mm-hmm. It's just a whole different, it's just a different level of stress. It's just a different type of stress, but it's still equally stressful. Yeah.
Definitely.
Were you ever worried about the market saturation? This is what a doctor told me when I asked for a resume or for a reference was, are you sure you want to do that? Market saturated. And I thought, I don't know. I mean, did you hear that? Were you worried about that at all?
I did, but at the same time, I was okay with staying at the bedside, and so I had a backup plan.
Yeah.
You know, if I didn't get the job I wanted, or something didn't work out,
kind of took the pressure off because you were just doing it just to kind of see what else.
Yeah. I got in. I applied. I got in.
Yeah.
I started, and I was like, oh, here we are.
And you went to UAD, correct?
I did, yeah.
Okay. And what did you think about that school? Did you have an easy time in school?
School doesn't come easy for me, so it took a lot of, it's mostly online. Like I'd say 90% online. I went to campus about 3 to 4 times for skill checkoffs, and it was not easy, but the teachers were awesome. They worked with your life. I mean, we had people from California to New York, so they really worked with you. I had a really good experience, and I went there because I knew a lot of people who had gone there that work with us, and so they got through it. And they came out really good nurse practitioners. So that's why I followed in their footsteps.
Yeah. It makes for a good review when you see the practice in real life. And I feel like we talk about UAB every single interview I do here because a lot of people go to that school. I think they do a fine job. So tell me about your clinical experiences. Did you do a lot of different types of rotations, or was it all ICU?
I did hospitalist and nephrology. I kind of split that in one semester. And then ICU, critical care, and then interventional cardiology. Obviously my whole background is cardiology, so I knew I wanted, or it was comfortable for me to go into the cardiology world, and so that's where I thought I was going to end up, interventional cardiology.
And you in all the different rotations that you had, I mean, I know that you really have just very niche experience as a nurse in cardiology, so you kind of always knew you wanted to stay in that area.
Yeah, it was my comfort zone. And so
I get it. Yeah. Okay, so tell me about your job. Did you have a hard time finding a job? How did you end up in this role?
So I graduated and got a job with general cardiology. I worked with them for 3 months, and I was pregnant at the time. So I went out on maternity leave, came back to general cardiology, and then CT surgery was going through a lot of changes with their dynamics and staffing. So I came back, knew about those changes. They approached me and had some people leave and wanted me to take on the role of their nurse practitioner in the group with CT surgery. So that's how that happened.
It just kind of landed in your lap.
It landed in my lap. I was approached. I've worked at the same hospital for 8 years, so they knew who I was and kind of seeked me out.
So this is why, y'all, this is why I say it all the time. A lot of times jobs aren't posted on job boards because they are hiring internally. They want to hire someone that they already know, their skill set, how they are to work with. And this is why I say you go out into the world. Maybe the first job you get isn't your ideal job. You go, you do it, you develop a reputation for yourself for being the best at it, the most efficient, the easiest to work with, and people will notice. They will notice and they will come to you. They say, hey, we really like you. Would you like to come work for us? We will create a spot for you. Sometimes they do.
Hey friend, are you in the market for a new or possibly even your first job? And are you frustrated by a lack of offers? If this is the case, one of two things is happening. Either the competition has better qualifications than you do, or the competition is interviewing better than you are. And guess which of these two you have control over? That's right, just yourself. You and yourself. You only have control over what you do in life. Now, what I find is that most nurses and NPs were never taught how to interview, nor have they researched how to do it. We need to take a number from our friends at the School of Business who know how to sell themselves. We can do it too. I help people by offering mock interviews where they get to practice their skills, and I also offer an on-demand digital course that is 19 videos totaling 3 hours and 9 PDFs. It's going to walk you through start to finish how to get ready for and deliver the performance of your career. It is going to be the most lucrative investment you could possibly make for the entirety of your career. The return on investment is phenomenal. Y'all, I've been doing mock interviews for a year. I am extremely proud to tell you that I have a 100% success rate within 2 months, and that's really only because of one outlier. Everyone has gotten a job offer, and it brings me such joy to know that people are landing their dream jobs. I'm not talking even like the second option. They're landing their dream jobs, people. There is a way to perfect this skill, and you really have to invest in it. I know you're tired of studying, but it takes a little bit of time and a little bit of preparation. You will alleviate a lot of the nerves and fears, and you'll be able to show your personality, and they will be wanting to offer you a job before you even leave the room. I can't tell you how many of my clients have told me they have heard those words. So if you're in the market for some help, please go check out my website at brienp.com to either schedule a mock interview or look into the digital course if that's right for you. Thanks for listening, and thanks so much for watching my videos.
But I want to backtrack just for a second because I didn't realize you had spent some time with general cardiology. How was that? You were working inpatient in general cardiology? Okay. And so what is the primary, like, what did you do during the day? Were you seeing people on the floor, like non-ICU patients, or were they ICU patients?
We had a couple in ICU that we would get consulted for like AFib, blood pressure issues that nothing was working, but most of them were on the floor. So new onset AFib, ACS coming in with bump troponins. We would start the process and then, consult interventional cardiology or however it went. Also lots of rhythm problems. So we would kind of be the forefront and then consult EP. Yeah. So general cardiology, it helped. I mean,
it's sort of like the forefront of everything comes through you.
And really, you're the one who has to work up the patient. Now, in CT surgery, the patient's been worked up. We know what the problem is. We just have to manage really post-op and a little bit of pre-op.
Sort of a little different focus. At our organization, we work for a very large organization, and so our cardiology group is massive. And as opposed to like community hospitals or smaller hospitals where everything in cardiology is within one group, we are very super segmented. So we have general cardiologists, we have cardiology teams that work just in the ICU, we have cardiology teams that just work in electrophysiology and deal with rhythm problems. We have structural heart teams, we have cath lab teams, we have surgery. So very, very super segmented. So I can see where as general cardiology, you're sort of like everything filters through you. You get a little bit of everything. But I do feel like what I hear from people is it's a lot of AFib. Everybody in the hospital has AFib, right? So you get very, very good at one particular
problem leads
thing.
to AFib.
Right. And apparently nobody else knows how to take care of it except for cardiologists. So they get caught on all of that. That and troponin bumps, right?
Yeah.
But the cool thing is, I understand from this particular group that does general cardiology, they have a very high census, a lot of patients. You got to work very, very fast, but you have a very like super focused, like you're only dealing with your heart issues. Everything else is pushed back out to the primary team or someone else. So you can get very good at one or two very common problems. This is what I hear from people who do that.
Mm-hmm.
So then you started with the CT surgery team, and tell me how that went.
Good. So I was trained for about 2 months. At that time, I was only a nurse practitioner for 8 months.
Yeah, you were
So
brand new going in this
brand
role.
new, yeah. Good thing about it was I knew the whole team. I knew the
Mhm.
doctors, the
Mhm.
mid-levels, the ICU nurses, CVICU nurses knew me, and so they weren't. They approached. I was easily approachable.
Mhm.
Vice versa, I could go to anybody for questions, and
Mhm.
we knew who each other were, and that's a huge thing. I knew
Yeah.
the computer system, so I didn't have to learn that.
Mhm.
It was a pretty good transition. I don't feel comfortable at all. There's still a lot that I have to learn and
How
learn
long have you
every
been doing it
day.
for now?
CT surgery,
Mhm.
6 months.
Okay.
Yeah.
Okay. Well, and so Victoria's story is a little bit unique in that I think not only was she a new grad going into kind of a tough role, and we'll get to the specifics of what her role is in just a little bit, but um, she kind of stepped into the shoes of someone who had left, who had been doing it for a very, very long time, who had really kind of established a program and a reputation for herself and her team. So she had some really big shoes to fill
I
on
did.
top of, this being fairly new to her, not only the specialty, but also in being a nurse practitioner in general. So, and these teams, what I see across the boards for surgical teams of any sort, is they are very, very fast paced. It is a well-oiled machine. You got to get going. Everything's on the clock with the OR. So it's very, very fast. So I would anticipate if I were in your shoes, that would be, I would have been nervous going into that role. Like, am I going to be able to do this quickly enough, efficiently enough? What was your experience with that like?
It was very overwhelming at the beginning because
Mhm.
a lot of it is logistics. Like I have
Yes.
to know where
Mhm.
all of the mid levels are. Like, are they in surgery? Are they in the office? Because I take care of the hospital.
Mhm.
Um, I can go to the office if they needed me, but my main position is the post-op floor. So
Mhm.
the step down unit after they move out of the ICU after open heart surgery or thoracic surgery. But I have to know where everybody is, what time surgery is going to start. If there's an emergency coming in, I have to coordinate like which doctor's going to do it,
Yeah.
which mid-level.
Yeah.
It's a lot of little things. Plus,
Mhm.
keeping track of the patients out on the floor
Yeah.
and following up with tests and stuff like that. So
Mhm.
my mind is in 20 different
Right.
places all at one time.
This is why I feel like that's a hard role. And it's not just post-op, right? It's pre-op, post-op.
Yeah,
It's
so they could be on the floor pre-op
right.
waiting to have surgery the next day,
Right.
but stable.
Mhm.
Um, yeah, it's a little bit of everything.
So
Yeah.
let me dig a little bit more into that. So tell me, because I know you are one of the few NPs within your group. Tell me a little bit about your work group and how the roles are set up.
Yeah, our dynamics are kind of different from any other group, I guess, because we're surgical. But I'm the only nurse practitioner on the team, so the PA is obviously helping the OR and surgery, and I'm not a first assist, so I don't go in the OR. And so I'm kind of the middleman, and everybody's kind of
Yeah.
around me. I mean, we all have the same important role of
Mhm.
doing our own little things, but yeah, so I'm the only nurse practitioner. I see patients out on the floor after surgery, and I can see unit patients too. If the PAs are busy in the OR, I'll follow up around on the ICU. So I'm kind of
You're all
versatile.
over.
Yeah.
So just in case that's so. All right. So the way that our organization is set up, they kind of preferentially have PAs in the OR. I know there are plenty of hospitals out there that do have NPs in the OR. I assume they have to get their first assist. Was this something that was offered to you that you were considering, or were you specifically not wanting OR time?
I don't think they needed me in the
Okay.
OR. I thought about doing my first assist, but I wanted to focus on
Yeah.
just what I knew and build on what I knew.
Sure.
So the OR, it would have been, more stress in school, and
Mm-hmm.
I just wanted to,
Get out and start
yeah,
going.
yeah.
Yeah. Yeah. And this is kind of the model that we have set up. So having said that, everybody's operating or getting things set up to operate, and you are in the units kind of troubleshooting, people who are getting ready for surgery, people who are out of surgery, dealing with the complications that these people may be going through, and taking in the new calls for consults and admits and things like that. So naturally, very, very busy, a lot of multitasking involved, a lot of different hats she's wearing, and just flipping them off, episodically throughout the day at a very fast rate. So this is why I say it illustrates that this is a very fast-paced group. This is a very fast-paced team to kind of work for. And I've seen this in different places. So I know that this is kind of the way that most places tend to operate. And I will say you have done it just beautifully. Like I was kind of surprised, like, girl, you've been doing this for a while. You're going to roll right into it. I'm stressed for you. But I mean, she makes it look super easy. Definitely.
You definitely like have a situation and you figure it out, and then you obviously remember, oh, I did this last time, so I'm gonna call this person and tell the OR to get ready for this, and it's just like a revolving, situation. So.
Right. Are there any particular textbooks or references that you could recommend to people who are going into cardiothoracic surgery?
I honestly haven't had time to do much really studying since I've been in this role. I really heavily rely on my coworkers and my PAs right now, but I definitely want to do some studying. So I don't have an answer for that, but there's definitely
so you're learning by experience.
Yeah. I need to do more digging.
Well, that's okay. I mean, in a lot of ways, that's how we all kind of start out. Like you get a problem, you get a new surgery or something, like, what is this? Let me figure out what this is and move on to the next.
Yeah, I need to go home and dig into.
So what are the primary surgeries that your team does?
Coronary artery bypass, so open heart surgery, lung surgeries, lots of lobectomies, mass removal, sometimes myxoma in the heart, and lots of decortication, so recurrent pleural effusions. They go into scrape out the lung so it doesn't come back. That's about it. So lots of lungs and open heart surgery. Pericardial effusions, so window.
Valves.
Valves. Of course, valves with a cabbage.
Okay, so one of the questions I get from people a lot is, what's it like to work with surgeons?
That's a good question. I have experience with them at the beginning. Oh my gosh, very intimidating, scary.
Sure.
You want to please them, but you also, have to have a backbone and stick up for the patient too.
Sure.
So it's a very fine line of advocating, but also learning and listening to them. Obviously, overall, I'm used to it. So they all have different personalities. Some are easygoing. All of them are very good teachers. They don't mind, when you ask a question, explaining what we're doing or why we're doing things. So I work with really good surgeons.
Yeah,
I can speak for my group, but.
Well, I think when you develop mutual respect, even some of the strongest personalities, no matter what field you're in, of physicians, once you develop some mutual respect for what they do and what you do, it becomes a little easier to handle. And you also can, in my opinion, you learn what their work love languages are. I know that certain doctors value this over that. And if I just give them that, they will love you for it, and it will make your life much easier. So adaptability has just always been a thing that I recommend to everybody when you're working with anyone. Really, it doesn't have to be just surgeons or physicians. So kind of going back to the work pace, how do you handle changing hats like that so frequently throughout the day and having such a large census? Are there any workarounds or tricks that you developed?
I rely heavily on my team. So the PAs, whenever they're out of surgery, if there's something little, I task them with something like, can you go get consent on this patient and tell them surgery's going to be tomorrow? A lot of it is logistics. Like, can we fit them in tomorrow? Are they going to go Monday? How sick are they? Do they need to go in front of this patient? So I definitely use my team. Hopefully when I get more efficient and smarter and I can handle things, like the previous nurse practitioner that I took over from, she did a lot. She handled it all. She did not need much help from her team, but I do. So I don't hesitate to ask for help and doing things.
And I mean, I think that if you are there to work as a team, right, and you're all trying to get these people in the OR and out and back home,
and they don't hesitate at all. So I'm able to do that. But yeah, it gets pretty stressful sometimes, especially if I have a little emergency out on the floor and they have to move back to the unit, but I have these other things to do or a new consult to see. They jump right in, and that's very helpful.
I think the other thing for me when I was new, and I feel like I'm pretty fast now, but certainly in the first few years, and it can take years, but it's just kind of knowing when to act and when not to act. And I'm trying to put myself in your shoes, and I would think, if you have to change things on the fly, like who's going to go to surgery before another, sometimes it's just a matter of evaluating the patient and determining how sick they are. And it takes you a little while to sort of develop that acumen of, yeah, this one's really sick. And I can tell that very quickly by looking at X, Y, and Z. And in the beginning, you don't really know that. So sometimes you have to rely on your teammates and your physicians a lot to say, hey, what do you think about this one over this one? And so over time, I think that kind of thing gets a little quicker and easier to do. And that's probably why she was so good at it. I have no doubt she will get
lots
there.
of experience. I came in, she had 15 plus years of experience.
Yeah. And you'll be there too in no time at all. You'll be teaching new grads. So tell me about your schedule.
So I work 4/10s and usually one weekend a month or every 5 weeks. When I work the weekend, it's like a Tuesday through Friday, Saturday, Sunday, Monday, Tuesday, Wednesday.
Oh.
And have like that Thursday or Friday off. So it could be like 10, 11 days in a row. The 4/10s are nice. I came from 3/12s, and so it seems like more work, but really it's only 4 hours more a week.
Yeah.
I would love 3/12s, but then at the same time, it wouldn't work with my life. I can drop off and pick up my son in the mornings with these 4/10s. So 7 to 5. And I've gotten used to it really quickly and easily.
Yeah.
It seemed like it would be a harder change, but it's not bad.
It's not. So what about the days when you're not there? Is there someone else that works, or is they just?
Yeah. So since I'm like the floor nurse practitioner, one of the PAs that worked the weekend before will work Monday. If I'm off Monday, they'll see the floor and unit patients, and they usually won't be in the OR that day.
Okay, I see.
Yeah.
All right. Yeah, I feel like it would. One of the jobs I had offered when I first started was 4/10s, and I debated it because I thought it would be kind of nice to like get home in time for dinner for a change, But then I thought, well, and where I was looking at was kind of far away from my house. So I was like, by the time I commute, get ready, and go back and forth, and then outpatient is a little different because of all the charting. I was like, it would end up being a 12-hour day anyway.
Right.
So I didn't think it was for me ultimately, but I do go back and forth with this shift work thing because 3/12s, while it's great, you have 4 days off. You have no help on those days. And when your kids are little, like you said, I mean, when my kids were little, I had to have a babysitter in the morning, a babysitter in the afternoon. I had different ones because different ones wanted to do different things. And then my husband tried. It's just a lot to do a 12-hour day, So I always go back and forth on what's worse, right?
I know.
Working an 8 to 5 job or working 3/12s. I don't know. Yeah. They're equally hard. It's just a matter of what hard do you want in your life at that time. Yeah.
The continuity of care, 4 in a row, it's really nice. I know all the patients by Friday. I feel really good, and of course the next week
you start all over.
New, pretty much new. I mean, some patients go home on the weekends, and then lots of surgeries on Monday. So starts all over again. But I feel really good at the end of the week.
One of the things I didn't anticipate as an NP, I mean, as a nurse, it was always kind of good to work your days in a row because it's easier if you know your patients. But like we were ICU nurses, so like 2 patients. So it wasn't super hard if you had to break up your days and then come in the next day and pick up new people. It's fine. But as an NP, it's way harder because the things you need to know about your patients and the plan is highly dependent upon so many different variables of the patient and what happened the day before. So when you work those in a row, she's right, by the last part of the week, like you're just fast. You're really, really fast because you know what's happening, you know what needs to be done. You have rapport with these patients. You know what they looked like yesterday and what they look like today, So this is why a lot of provider type roles are 7 on, 7 off. And I do see the value in that, but I also don't think I could ever do that work schedule.
No, me neither.
I'd rather just try and figure it out. On that first day is hard. Every Monday is hard when you go in, brand new set of patients. So you spoke just a little bit about having kids. So I know that you have very young children and you've been going through this schooling and new NP thing. How has that been for your family in regards to you going through all of these changes?
So when I started my master's program, I got married, and then towards the end was pregnant. Took a year off from school, went back, graduated, got pregnant, finished my master's. It's just been, looking back, I don't know how I did it all, but we make it work. My husband works 12-hour shifts, 4 days in a row, 4 days off. So his schedule is hectic too.
Yeah.
We make it work somehow.
Yeah.
I really don't know how. Obviously daycare, grandparents help a lot.
Yeah. Yeah, those years were kind of a blur for me. I feel like when your kids are very small, I cannot imagine doing school on top of that. It was so hard just to get through the day. So I'm always impressed with all of you young people who are doing this with young families. Mine were older and a little more set, but hats off to you. That cannot be an easy task.
It's not. But also, like, I worked part-time at the beginning and was in school.
Mm-hmm.
I can't imagine being full-time. So give yourself grace
Mm-hmm.
and not rush through things and take your time.
Yeah. I
Less
always
pressure.
tell people, like, pick 2 or 3 roles in your life when you're in school. It's going to be student, worker, family person.
Mhm.
You're not going to be able to do all 3 of them. So
Yeah.
you got to kind of pick and choose what you're going to focus on in that moment. And sometimes it changes.
Mhm.
But yeah, full-time work, that would
At
be
school,
hard.
no.
No way.
Hmm.
Okay, so the last question I have for you, because I have so many of you who are looking to go into this role and interviewing with cardiothoracic surgery teams, is what are some qualities of a new hire that you guys would be looking for? Like, what makes a good NP in your role?
Efficiency and
Yeah.
obviously expertise and being good at what you do. So like in the OR, being really efficient because a lot of stuff is based on timing.
Sure.
Not how fast the surgery can go, but the doctor needs to be in and out so we can move on to the next surgery.
Right. So if you're not good at harvesting that vein, they are not going to be happy with you.
Yeah, as far as PAs. And then I guess in my role, being efficient and not really needing the doctor as a backup.
Work independently.
Right. So,
which is intimidating as a new grad, right? Because you don't exactly know all the things. So
right. They give me like the tips and tricks on what to look for in an x-ray and what to be alarmed at. And I don't hesitate to ask them, I need you to review this before I send this patient home.
Sure.
But they really rely on me to know my stuff so they can be efficient in the OR and in other places.
Well, and that's why I would think that having worked as a CVICU nurse is probably helping you a whole lot here, because you're more familiar with the surgeries, you're more familiar with what the physicians are looking for as far as outcomes go and
what can go wrong. They trust me to raise my flag and say, hey, something's wrong here.
Yeah, I could see that. Okay, that's very helpful. Victoria has been killing it in her role, and going into something this intimidating, fresh off the gates of finishing school, is hard, and she's made it look very easy and seamless. So hopefully you all will have similar experiences, and thanks for joining us today, and see you next time.